This is the Aesthetic Angle, sponsored by Monarch Plastic Surgery, Skin and Injectables, and also Wellness. And I'm Dr. Paul Leahy, one of our board-certified plastic surgeons, and I'm so excited today to hang out a little bit with some of my friends and colleagues and to bring you something special. We're going to primarily be focusing on tummy tucks, called abdominoplasty. And I'm joined today by Kimber, one of our longtime nurses, our primary nurses, and Jessica Hager, also one of our longtime aestheticians. And you know, guys, it's funny. It's like as I was walking over here with Kimber, we have a lot of years of history of Monarch sitting in these chairs. Like we could tell some stories, you know, and some good, some tough times too. And the sun always comes up, and so we're excited to bring you this topic today. So we're just finishing we just had Halloween about a while ago, and you both have daughters. Jessica has 3, Kimber has 2.
Yep.
Tell what happened. What was your houses like?
I mean, chaos.
Yeah.
Lots of candy.
Yeah.
I had so much candy before Halloween that I didn't actually have to buy candy on Halloween to pass out.
Perfect.
I just dumped the candy that we had already gotten into the bucket and then regifted it.
Love it.
That's
and
a
then
great
I
idea.
still have Halloween candy.
You'll still have to
too
try to
much.
bring it to work
Bring it
and
to
stuff,
work.
you know, like there's tons
Well,
of-
yes, I plan on that.
So I learned something. So I love Reese's peanut butter cups. I even had a dream about them once when I was a kid. But anyway, but I don't like the ones with jelly in them.
Oh, okay.
There's like
haven't
strawberry.
had
I know someone.
I don't think I've tried those ones yet.
I can skip that.
Butterfingers
But
are my
anyway.
vice.
Okay.
But they know to set the Butterfingers aside for me.
Keep those later.
I can bring you in some cups. if
Okay,
you
we
want
can
some
trade.
cups.
We can
Okay,
just
yeah,
make a
trade
trade, I'm
as well.
sure. So. Well, so let's talk a little about what tummy tuck is and stuff. I can kind of start with that. And then I really appreciate you both being willing to share your own personal stories because you've each have had the procedure too. And you can kind of just tell whatever you feel comfortable talking about that you think our listeners, our patients might, little tips and tricks, and especially from your viewpoints of a patient, but also a nurse and an esthetician. I'm really excited to hear what you can add for us today. So a tummy tuck is a surgery that probably incorporates a few different things. I think the number one thing is to remove redundant or excess skin and fatty tissue, primarily in the lower part of the tummy. We do a lot more female surgery, but there are some guys sometimes, particularly like we're seeing a lot of massive weight loss, we call it. So with some of the new medications out and the surgeries, that even guys will have redundant skin that bothers them. And that actually is a little bit of a different procedure, but for women especially, we're trying to create a final scar and an incision line that blends in well with like your waistline. There's typically a little scar around the belly button. But what we're really doing is we're lifting up that skin and that fatty tissue layer so that we can access the muscle layer. So with pregnancy, just the way things are, the little connective tissue between our muscles will stretch and thin so the baby can grow. Well, you can do sit-ups all day long. There's pretty much no getting that back to just normal anatomy. So while we're in there, we can use stitches that bring that layer together that you really can't do any other way. A lot of times we are doing some liposuction, so vacuuming out some extra fat in other parts of the areas, like, for example, like the love handles or the flanks, sometimes the upper part as well. And then pulling things down, remove the extra, put it all back together again. And so it's probably one of the bigger things that we do surgery-wise in terms of just kind of what the recovery is like and the invasive nature of it compared to some other things we do. But people do really, really, really well, particularly with some of the other little tricks that we'll talk about today. And, so I'm in my 18th year of practice, and then my training was 6 years before that too. And my dad was a plastic surgeon too. So I've been around this a long, long time, but it gets better and better and better all the time. Matter of fact, I will say, I probably have learned more about the tummy tuck operation from Dr. Steen,
Oh, wow.
Yeah.
who joined us from Canada.
Yeah.
And her approach to it, I really, really like. For example, the drainless tummy tuck, so
Yeah.
avoiding drains. I haven't used a drain on someone pretty much since I saw her do it.
Yeah.
And I think for a long time we were just resistant to like, new change. You're sort of set in your ways or whatever. But I love that. And then the safety of some of the new medicines to avoid heavy pain pills and just getting people up walking. So anyway, a little rambling there about what it is from the plastic surgery standpoint. Maybe I'll just kind of turn it over to you guys a little bit, and we can just have a conversation about, well, maybe even starting from the beginning, like what made you even think about doing it, and getting the courage up to do it. So
Well, I've got 3 girls. And so after my first daughter, he lost all the baby weight, my body was still not the same. Even, just after that first pregnancy, I gained a lot of weight with all 3 of my pregnancies. And so, by the time I was done having kids, my last 2 babies were 9.5 pounds. So I gained a lot of weight on top of carrying really big babies. So there was just no bringing my body back to what it once was. And so it always bothered me. I felt like I kind of hit it very well. So when I started entertaining the idea, I had a lot of comments like, well, you don't need that. I can't tell. But sitting in my own skin at home, I was very uncomfortable with it. And not only that, but there was so much excess skin that I had to go up a size in my pants just when I sat down because so much skin fell over that it was uncomfortable. So anyway, I was very insecure with it. But then I also really struggled with my body insecurities while raising daughters. So that was a big struggle. I think that I talked to you about that a little bit before I got it done, was how do I talk to my girls about, body image and being self-conscious, but then feeling good in your own skin. So it was something that I really struggled with initially. But once I kind of got over that little bit of a hurdle and made that decision, I was stoked and very excited. And so it was life-changing. It was absolutely life-changing after I got it done. And even now, I'm not even a full year out from it. And, just going through the summer and being in my swimsuit and sitting down in pants and, sewing my muscles back together, which was just wild. And I would say, like, when you said, like, oh, yeah, I gave you a 6-pack, I'm like, oh, it's not serious. And then I'm like, oh my gosh, no, he was actually very serious.
that's crazy.
That is wild. Yeah. That was probably my hardest recovery, was the muscle. I thought being, because my incision is hip to hip and even behind a little bit of the hips. And so I thought for sure that was going to be the most painful part, was that big cut. No, it was the muscles. The muscles were the hardest part of the recovery. But I did my laps around the kitchen table, and I did my walking, and walked with my little bit of a hunch for a good 3 weeks or so before you could stand up straight. So, but anyway, the recovery in itself, it's not easy, especially when you've got children running around at home, but it's doable and it's temporary. Yeah. And so I felt like, I got a lot of good information going into the surgery, and then advice from, friends that have had it done before. And so I know it made the experience, doable. It's doable. Yeah.
Well, thank you for saying what you said, Jess. I mean, it takes a lot of courage to say those things you said and to come with that, and then to commit to a surgical procedure, which is a big deal.
It's a very big deal.
For that,
Yeah, it's it's the surgery in itself. Over 3 hours. I mean, it's quite a time-consuming surgery, and it's a big deal, and there's quite a bit of recovery, and there's also some emotions that follow post-surgery.
Absolutely.
Yeah, and I can't remember who told me about that, but it's a real thing.
I would love to get into that. And I really appreciate also saying about your daughters too, because it's really not fair for me to talk about, since one, I'm a guy and I have boys, but how do you address that, particularly just today's environment and raising strong, confident people, but especially girls. And, I'm explaining that you're going to have this done, but yet you're perfect the way you are. It just, there's so many nuances about that. I'd love to hear more about that. But Kimber, did a lot of that was similar, but
mine was long enough that I did have drains.
So I thought yours was drained. Mine was drainless, which was amazing. Yes. So yeah.
And even with mine, I gained weight, but mine was also actually really more of my muscle protuberance afterwards, so sticking out, that I had a lot of laxity. So my rectus just did not go back where it was. I had extra skin, but I was more, if I didn't suck my stomach in all the time, I felt uncomfortable. And I did have a little hernia as well from my second one. I got that, the second one.
Like your belly button.
My belly button.
Yeah, those are pretty
little
common.
umbilical hernia. But yeah, I mean, it was life-changing, where you could feel good in your skin again. It was, going from what you feel like, before kids, and then, kind of during that pregnancy process to after, and, you're taking care of everyone. And then when it kind of comes back to you, it's like, wait, I don't even feel like myself, and I don't feel like I look like myself. And so I think, it was life-changing.
Yeah, it really is.
Absolutely.
Did your girls do okay? They were
Mine were very young. So my oldest, she helped me with the drains, and, she was kind of my nurse and everything afterwards. So they were still young enough that they didn't really realize during the process. But now if they see my scar, my youngest will ask. But it's just, one of those things I think as they get older, we'll definitely talk about. And be open with it.
Yeah, that's great. That's awesome. And you have kind of a range of ages of your daughters too.
I do, yeah.
So
my oldest, she understood, she got it. I think she was just more worried about me going under than she was about changing the appearance. My middle daughter was very confused on both of them, And at the time, I think she was 7. And so just trying to explain to her that, this is sometimes what happens, after you have babies, and this is a choice, this isn't something that everybody has to do. Because then she thought that, oh my gosh, if I have a baby, then I'm going to have surgery after.
Yeah.
So it was just really trying to tell her that, it's a choice. It's not something that every woman has to do, and that I'm going to be okay. And just try to spin it into something more positive, because it was positive. Yeah. And when we talk about it being life-changing as women, I knew that I was going to be happy with the results, but then actually post, a couple of months or a few months after, when you really when some of the swelling really starts to go down, it's like, wow, I know I can't cuss on this thing, but holy moly. Yeah. It was, a body that you sit there and you dream about.
Yeah.
Not the body that I used to have. This was a body that I have always dreamt of having. Like, it's just, it's such a unique personal feeling. And it's, I would do it again. I hope I don't have to do it again. But I would do it again.
Yeah.
I would do it again.
Absolutely.
That's
and
fantastic.
I can see how surgeries get addicting.
Right.
But no, it's incredible, and I'm so happy with it. And some of the emotions that I went through afterwards was some of the things that you talked about, was like not being able to pick up my youngest daughter. At the time, I think she was 2. Yeah. And so, not being able to pick her up or put her in the car seat or get the girls out of bed or feed them breakfast, or just needing help going to the bathroom.
Right.
Like, that's a real thing. Like,
It is.
you have to have somebody put you on the toilet, take you off the toilet, put you in bed, help you out of bed. I mean, it's a lot of work for the other person involved that's helping you. And so after a couple of weeks of that, or I think it was about a week and a half of that for me, when I still couldn't do those things, mostly, the heavy lifting stuff, I guess, it was really challenging. I got very emotional.
Yeah. Like feeling helpless a little bit.
Helpless, and, not that I ever second guessed my decision, but it was, I felt bad.
Yeah, I can
felt
understand
bad.
that.
I felt
And I
bad.
think that's very common.
Yeah.
That's one of the things that I always tell women on our pre-ops, that it's usually around that 2-week mark, you kind of get this depression. And I personally, I feel like it's partly you're so used to, going 100 miles,
And
boom,
all the
boom, boom,
multitasking.
and all the
Yeah.
multitasking. And then when your body's saying, absolutely not, you're not doing this, that's a little frustrating.
Yeah.
And I think that really happens around that time when mentally you're clear, but physically you're exhausted. You're still healing. And, I tell them that it took about 4 weeks for me to feel somewhat normal, I guess, again, in my own skin, and
would
that
say
I
it was
could
about
keep
4
up.
weeks too. Yeah.
Yeah. I had a little tiny just a fraction of what you guys went through. With a procedure we had done over in the IOP or clinic room over there, and it was a new technique we were trying out, and everybody, like, I felt like a million people were watching me over there. I was like a guinea pig for this thing, and I remember getting in my Jeep to go home, and I had this swollen and bruised, and I'm like, look in the mirror, like, why did I do this? And so I just had some little fractions of what you guys went through with that, but I'm like, it took me a bit to think, okay, all right, now I can see some results. So, all right, this was okay.
Yep.
And so I learned a lot about talking to my own patients too, about how to, what you might experience. I mean, I guess it sounds like you really find that with your
absolutely.
consults.
I feel, looking back at all the years before I hadn't had the tummy tuck, it's like, oh, maybe I kind of lied a little bit.
Yeah.
Because
right.
you do the best you can. But now I think with my personal experience, now everyone's different. They don't have the same, pains that I did, that same swelling. But, I really feel like it gives me a better perspective and how to help my patients through when giving them my own. And so I think definitely just those expectations afterwards is a huge, huge part of that healing process.
I bet they love hearing that from you, like, especially the procedure you had. Like,
I know I did. You were very helpful before I had mine done. And even just afterwards, the amount of support from, Maggie and you guys and everybody here was phenomenal. And I also found too that I was very private about it in the beginning. I did not tell a whole lot of people. I mean, obviously nobody at work really knew until I walked in with a hunch,
Yeah.
I was scooting along, gone for 2 weeks. Now when I see patients walk down the hall that are bent over like that, I'm like, ooh, I know that walk.
Yep.
I know that walk.
Yep.
But I found the more that I opened up about it, it's really nothing to be ashamed about.
Absolutely.
And not that I was ashamed about it. I'm just a private person. But the more I talked about it and opened up with patients about it and other staff members, you hear about other people's struggles too and how it brings them confidence. I've had a couple of patients who were considering it. And then, I talked to them about my experience and they've done it. And so I just think it's, whatever makes you feel good about yourself, do it.
Absolutely.
Yeah.
Why not? If you
Totally.
can, of course.
If it's
Absolutely.
safe, the time is right, and all
and
that
you're a
kind of
good
stuff.
candidate,
I think I told you this, Jess, but I'll say it again and to everyone. There is, as the surgeon who's going to perform a surgery on someone that you're close to and you see all the time, it does raise your stress level a little bit. I mean, that's why you're a good candidate, and this is the right time to do it. But you just want that extra little bit, like hope, pray this goes well and everything. And so it's a little bit of anxiety. And I remember, I think Maggie had said to me something like, my primary nurse who comes back tomorrow.
She does?
Yay. She was like, I think, Jess is thinking about having this done. And I was like, oh, that's great. And she's like, no, dummy, with us. Okay. Because we had chatted in the hallway maybe about, what's it like? A quick little 2-minute thing. I was like, okay, well, great. Well, let's get her in and actually really sit down and, spend time with it and everything. So, but I'm just thrilled you did so well.
I am grateful for, like I said, I was expecting just the body I had before, and you literally created a body that I've always dreamed about. So, I mean, like I said, I'd do it again.
Well, I remember you came back for the day one visit, and again, like you said, you were only really your close friends at the office kind of were there and stuff like that. And I think you kind of looked at me, and I could see in your eyes it was sore, and again, the things like Kimber mentioned, but then we kind of took off the dressing the first time you saw it, and you were like, and then
even
you had,
with that swelling, it was like, oh my gosh,
it's crazy.
It's crazy. It's wild.
Just this, like, your only emotion was like, I need a hug, it was that. I will never forget that. Actually, I really appreciate that. And, but it's fun, and I'm glad that we can, that you can now help other people who kind of seen. So I thought so Jess is doing something kind of interesting with her scar, since you have access to everything and we got all kinds of cool tools over there, try to see what things might help, with the appearance of the scar. Can you talk a little about what you've tried?
Yeah, so I've done a combination between BBL and skin pen, which is microneedling. So, and I still feel like I've got a ways to go working on it, but I feel like I've lightened it quite a bit just with those two modalities. So BBL stands for broadband light. It's a light therapy treatment that we do that works on, hyperpigmentation, broken blood vessels, that sort of a thing. So it's attracted to color in the skin. And so I've been doing that along my scar quite a bit. And I've been trying to do it monthly. And I've felt like that in itself has worked really well. I'm fortunate that my scar is already pretty flat. Thanks to you. And so I don't feel like I have a lot of texture. But I've still been going over a little bit with microneedling just to kind of break up the scar tissue involved with it. So I think the combination has worked really well. I do plan on dabbling a little bit with VI peel. We do it for the face, but we also have the body peel. That's great for scarring too. So I plan on kind of trying that maybe a little bit this winter. And I think that scars are unique to the person. And I think that anytime that you sign up for surgery, there's going to be scarring. So definitely expect it. Everybody obviously heals differently. Everybody, cares about the appearance of the scar differently. For me, I'm happy with the way it looks. So it doesn't necessarily bother me, but I think that it's a great thing to practice with because I know so many patients who get surgery, that's a big thing of the scar. So it's just fun to kind of experiment and play with it.
Oh, I love it.
And it's, I would say half lighter. I'm not even a whole year in, and I would say 50% improvement.
Yeah, that's so good.
Yeah.
Well, that's kind of you to make that comment about the surgery. And I think, as plastic surgeons, we definitely strive. The holy grail is scarless surgery, which I'll never see in my lifetime, probably. But and, of course, we do pay attention to that. But the truth really is, it's how your body's going to heal. I mean, people, just like you mentioned, are so individual and different skin types, different activities, and where the scar is placed. And so did you try anything interesting with your scar? Or?
Not really.
Okay.
It was really just kind of some basic scar massage and then some silicone taping. I mean, I'm at 4.5 years in. So, with mine, they don't bother me. I think it's more of just that self-confidence that, I see them, but it's nothing that, I guess is scary at this point. At first when you see them, it is a little scary to kind of see that big of a scar. But I think just with your guys' technique and suturing and watching it and watching the healing process and knowing that worst case, if there was something, it was a little thick, it was a little too pink or purple, then there could be things down the road if we needed to do. So, which that's obviously not the goal to have to do that. But I think just with the care during that, initial process, I think is good.
Would you say 4.5 years in that yours is mostly naturally faded?
Yeah. I mean,
and so I tell people too, is that, if it's not something you want to address, it will over time
absolutely
fade. I mean, I really did nothing to my throat, my scar on my throat, and it's, faded.
Yeah, that looks great too.
It looks great.
Mostly on its own. So
absolutely.
Yeah. And that part of the body tends to heal pretty well too.
Yeah.
Tell me does too.
Yeah, I think so too.
Like, in consults, we're kind of like, okay, well, let me demonstrate to you kind of where I think the scar will go, sort of waistband.
Yeah.
Sometimes it comes up a little higher, sometimes a little lower. It just depends a little bit, but your goal is to get the tissue out.
Yes.
And I always say, listen, I know it's scary. I'm pointing hip to hip, but it's really rare after a year or so that someone really even talks about their scar from a time.
I agree.
Yeah.
A lot more for something like face or arms or something like that. So
hip to hip did sound scary.
It does sound scary.
Yeah. Well, it made it kind of a little bit justified. Okay, yeah, I really do. And I think I remember talking to you about okay, so this is what this looks like. Is there anything that I can do to prevent surgery? Is there anything that I can do for this skin, or, do I need to work harder? Do I need to, go to the gym? Which I don't do. But, and you were very honest and you said, no, there's nothing that will retract that skin back.
Yeah.
You are a good candidate for, this procedure. And so I think it just justified how I felt about myself and was grateful to know that okay, there's not anything that I wasn't doing right or wrong or, to help improve it. So, but yeah, hip to hip did sound pretty scary, but it's really not, I mean, like I said, the incision itself didn't hurt at all.
Yeah.
Usually not too much.
If anything, I'm starting to just now get feeling back. And I was kind of numb it's still a little bit here. But I'm starting to get some feeling back there. Like I said, it was just the muscle that was the worst part.
Yeah. That makes sense. And you've been to see one before, right?
Yes.
So in real surgery, you can see why it would be sore.
Oh, absolutely.
So
yeah, I saw those pictures.
I know. I do. I just like to take pictures of it.
I have pictures of mine as well.
It tells you why you're sore.
Well,
absolutely.
100%. And it was actually I mean, it was really cool to see. But my skin looks like hair on old Ted. I got from my stomach. It does.
Yeah.
I think I showed it to you. Yeah, I thought it was funny. Every time I see it, I'm like, it looks like Hey Arnold. But I thought it was and I don't know what tummy tucks were like back in the day, but when you were talking about the lipo, I envision always seeing those little lipo scars everywhere. And I thought it was cool that you did the lipo before you removed the skin.
Yeah, then you can remove those little small.
And then you remove the little
scars and
yeah.
stuff.
So I had lipo, but I've got no scarring from that, and I don't know. I just think it's magical.
Well, yeah, that lots of changes. I think probably from my view, probably the most revolutionary thing has been this drug called Exparel.
Yes.
Oh yeah.
So in fact, I won't even offer it without it. I think it helps the safety of it so much. So this is a long-acting numbing medicine. Typically, I think the product tells you 48 hours or more, 72, but so 3 to 4 days though really is what we usually see. So you don't even know what happened. This is while we've got everything, opened and exposed, we can inject this medicine right into the tissues where it's most likely to hurt. And then what it does, it's basically, it's a numbing medicine we've always had, but they found a way to like package it with these little fat coverings in a sense. So that over those days, the little fat capsule dissolves and the drug comes out at a small rate. Yep. So showering those tissues with this numbing solution. I mean, because now people can get up. I mean, it's not fun or easy, but you can get up.
No,
so
it's not fun.
I know
It's that transition.
I know.
Yeah,
it was not fun.
But the thing is that before that though, people would just lay flat in their bed and they wouldn't get up, and that's when you can have problems.
Yes.
Yeah.
Blood clot is the most dreaded complication. That has gotten so much better.
Yes.
Pneumonias from not taking deep breath. Urinary tract infections from not being able to go up and go pee.
Yep.
Just all these things. Anyway, I just love that medicine. So if it was cheaper, we use it for everything. But anyway,
Yeah, absolutely.
Well, and I liked that I didn't have to be on like pain medication because I've had side effects from that, from other surgeries that I've had before. I get like this itchy response to it. And so I just round the clock did Tylenol and ibuprofen. And what was the other one?
I like this drug called gabapentin.
Gabapentin. Yes, gabapentin. Yeah. And worked perfectly.
Okay,
I didn't
good.
feel like I needed anything else besides that.
And see, that's the same with me. I get a lot of nausea, vomiting with any kind of narcotics. So not doing that, but having the Exparel really helped those first couple days, getting in that routine at home and really kind of seeing myself, you have to get up, get moving. And honestly, that helped. I feel like just with the discomfort was getting up and moving as well.
Like mobilizing things. Yeah, I think so too. That makes sense.
When you're stiff, when you're sitting for so long and then you go to stand up, it's an initial soreness.
Oh, absolutely.
But once you start getting up and moving a little bit more, like I said, initially I do laps around the kitchen table and I count however many and I'm like, okay, I got my steps then. And then I'd go sit back down, but then I noticed like it made me feel better to move and not be, stationary for long periods of time.
Can you guys talk a little bit about maybe your first couple of days back at work? Like
I wish I would have taken a little bit more time off because my job is a little bit more laborious. I feel like if maybe I had a desk job, I think 2 weeks would have been fine.
Because your hands are, you're doing this a lot.
I'm hunched over, I'm standing up, I'm doing lasers, and I'm up and down a lot.
Yep.
And so I came back, I think about like 2.5 weeks, and then I came back slow, which was good. But I really feel like I should have done like probably a full 3 weeks, given my job. It was challenging because I was moving slow, and I'm used to moving very fast. And so I think that was a little bit of a challenge.
So you did
me.
like half days or just less frequent patients or something?
Yes, I think I came in maybe an hour later and went home. I started late, left a little early, and then I tried to put blocks in for just to move slow.
Get the room ready.
Get the room ready, and have a little bit extra time. But I still felt like I needed, and I was tired. How long does it take the anesthesia to really get out of your system?
A while.
A while.
3 weeks is probably what I would say.
Yeah. And so I felt like I was still kind of battling a little bit with just being tired. Yes. And so I was better by 2 weeks, but I don't think I was ready to be up and down as much as I was.
Yeah.
But then, it helps too to, again, move your body and not sit around too. So, I mean, you kind of, I don't know. What about you? I felt like I could have used probably a few weeks.
I mean, I took 2 weeks off, but In mine, I'm up and moving a lot as well, but I don't, really have to hunch over anybody or, any of that strenuous. So, but I also had the MAs that helped me kind of get when I'm like, ooh, I'm getting tired. I need to go lay down for a minute. Give me 10 minutes. But I mean, I feel like with my 2 weeks, I felt like it was still a struggle when I came back. But I think it was just one of those things that I just kind of worked through it. I was already in that mentality, like, okay, I'm good. I got this. And maybe pushed myself a little too hard when I first came back.
Pay for it a little bit. Right?
Yeah. Absolutely. And then you get a little bit more swelling, but then you then when kind of that swelling goes back down, you're like, okay. And you just kind of keep moving through it.
Yeah. I bet you probably learned your job was more physical than you might have thought
absolutely.
Because you had
100%.
Until you feel it, right?
Yeah.
100%. Yeah.
Yep.
Some of the things that I guess in my own patients, I'll just say, who've had tummy tuck and liposuction, some of the disappointments, if you will, some of the things that people will come back and say, I wish this could have been different. I would say a couple things. One is scar placement. So the height on the trunk, oh, I wish it was lower. Actually, kind of wish it was higher. It's right on my waistband, something like that. There can be, we call them contour irregularities, like a big turn, so just some waviness here that's not on the left side, right and left differences. Sometimes folks will have fatty tissue on the insides, like around your organs, that you can't get to or change with a tummy tuck. That's because we're working above those muscle layers. And so some of those things are just they do take a little bit of sort of diet exercise things. And that can be a little tricky to introduce that concept to people, like, oh, it's still full at the top, and we can sometimes do some little touch-up things, a little bit of more liposuction. Sometimes there's some little things that you can do to get around that. Now we know from Jess, we get things you can help with the scar. But those are kind of the main things. Once you get over the hump, people are usually pretty pleased with it.
Yes, 100%. Yeah, I know that I definitely was.
And I guess the other thing that's kind of interesting is how changing, like when we think about the body, our trunk, meaning even from your shoulders down, really is one, we call it an aesthetic unit. So sort of like chest or breast do kind of go a little bit with the tummy. For example, like people tease sometimes when you do a breast reduction, and they're like, why'd you make my stomach bigger?
Yes.
Like, well, we of course didn't do that, but now you're experiencing the difference in like harmony of, how the trunk is and stuff. So I could see sometimes people are like, well, now I'm thinking about doing my breast, or when maybe you start breast and go to tummy.
That's what I'm saying. I can see how this can be addictive.
Right.
I can see why people come back for more.
Right. And I never have loved that term mommy makeover, but it's what people call it, you know, and I think Dr. Spaniel and Steen talked about that in a previous episode, but usually some breast procedure and body at the same time. I'm a little more conservative on stuff like that. I really like to limit the operative time to a certain amount. So it has to be just the right person where I would offer breast and body at the same time. But my partners do it all the time and great results, and it's safe. But I like to focus on the one that I think is going to be the biggest recovery, the tummy tuck, and then see what else comes next usually. So, but well, let's see, we're almost ready to wrap up. Do you have anything else maybe like from each of your perspectives that you could say, Kimber, when you're like, for example, you may go back to the clinic this morning and you and Dr. Spaniel will see a new cosmetic consult for tummy tuck. Like, when he leaves the room, what kinds of things do you say?
We really try to get into it. I think that's great about my job. I get to kind of really get in with the patients and kind of get to know them and what they want. But I think just seeing that a little bit of insecurity or something they don't like about themselves, that's such a vulnerable position. And I think just them being able to open up to me, but just trying to get them through the process, but also make them feel comfortable. What are their expectations? What are they expecting from this? Because, everyone is so different in what they need. But I think just really coming in, making sure they ask all the questions that they want and not being afraid of asking something that's going to be, offending anyone or anything. But I think really just to be open and honest, and I think, try to help them through with best that we can.
Yeah. Do you notice that like one of the most trickiest part about the consult can be the pictures?
Oh yeah.
So taking before pictures. People really are, I got to take this whole gown off.
Yeah,
I'm like, I know
exactly.
it's awkward, it's quick, but
Yeah.
it's so helpful later and for
Yeah.
planning.
It really
It is
yeah,
for,
the
especially for
pictures.
planning. I mean, I think that is, but I always try to give them the choice. Are you okay with taking these today? Because a lot of our patients we do bring back, depending on when surgery is in comparison to the consultation. But, that's a big portion of it too. And that can make someone very uncomfortable. So I think just having that opportunity to kind of, if they don't want to that day, that's okay.
Yeah.
But I do agree. If they come back and ask questions, that's very helpful to have those pictures to be able to kind of guide them in the right way.
That's I like how you guys do that. It's good.
Yeah.
People probably aren't necessarily coming to you for the tummy tuck consult necessarily, but they might ask about scars and things that what have you learned that you could share?
Well, that, everybody kind of responds differently in a different timeline. I always really try to paint the picture very large for people. Like, this could be 3 to 5 sessions, or we could be doing this for a year, but, stopping whenever they feel like they're comfortable with where we're at in the scar process. I have a client right now that I'm working on her breast scars, a little bit of her tummy tuck scar, and then some lipo suction scars. And, just after a few sessions, she's already really happy with some of the way her scarring coloring is looking. And then we've shared a lot about, our experiences with, her tummy tuck and my tummy tuck. And I just feel like it elevates the relationship a little bit when you get personal like that.
Yeah.
They let their guard down a little bit more. It's a little bit easier to talk to them. And then I feel like there's that instant connection. And so that's where I've found opening up about me getting this treatment done and the surgery has been beneficial, and just somewhat empowering other women, or I have a patient whose son got it done, and so just even talking about even how much it made him feel, and then my experience, and then just even talking to her about it. And so it's endless, and it just makes people feel good. And that's what I love the most about my job, is making people feel good.
Well, we are incredibly lucky to have you and our whole team. And, that really does set us apart, that we've got the wellness aspect now, and
Yes, I
the
agree.
injectors and everything, and the amazing nursing staff we couldn't do with it. And everybody else who just supports this thing going. I mean,
Yeah.
and Jen Parker Quinn, our marketing director, put this. We got Nate. I mean, and so I just love that. And Jess, you probably deal a little bit more maybe with our facelift, our post-op facelift folks, just because your job tends to be a little more face focused, maybe, even though now we're doing a lot of body things too. But so I was really careful about, okay, well, surgically we can do this, but guess what? That didn't take away the need for your products and the lasers and resurfacing and care. It's an investment, the whole thing.
It is an investment. And that's one thing I like about working next to plastics is we complement each other so well. Like, we can do things that you guys can't, and vice versa. And so I think that it's a great place for a one-stop shop.
Well, I'll let you guys get back to your busy jobs. I am so appreciative of you both for coming, and use the word vulnerable, Kimber, and I love that. It's true.
Yeah,
I mean,
it's true.
you're telling the whole world about something, a choice you made, and it can be an intimate conversation, stuff like that. I really, really appreciate you guys doing that. It's a lot, and just grateful to work with you both. So hope you guys have a great day. Thanks for joining us today.
Thank you.
Come see us here at Monarch. Have a good day, everyone.